Andy here, welcome back to our periodontics class. Today I will discuss the treatment planning process and the 5 phases of periodontal treatment. The goal is to understand how we can systematically manage periodontal disease for optimal patient outcomes. Periodontal treatment is a structured process focused at restoring and maintaining oral health in patients with periodontal disease. As a dentist, we collect all the information and assessing the process, which we call treatment plan, is the blueprint for case management. Includes all procedures required for the establishment, maintenance of the oral health. The goals of periodontal treatment are as follows. For the short-term goals, reduce gingival inflammation, control plaque, calculus accumulation, and improve comfort aesthetics. For the long-term goals, eliminate pain, reduce tooth loss, arrest hard soft tissue destruction, and establishing occlusal stability and function. And the picture visualize how a healthy and periodontitis gum could look like, as we see in the picture. Healthy and unhealthy gum tissue. Sequence of therapy is as it shows in the diagram. For the periodontal evaluation, if there is no attachment loss and localized inflammation, we use the prophylaxis treatment way. If there is generalized moderate severe inflammation upon the scaling, we need to reevaluate the disease is resolved or not after few months. After the patient comes to the clinic and receive all help, and we check it depending on the case after 3 of 6 or 1 year of recall. If there is the attachment loss to the right, we call it periodontal maintenance. This is controlled. It goes to the periodontal maintenance. If disease is not controlled, then a scaling and root planning happening, which we later on reevaluate the case. If the case is periodontal maintenance happened out the patient took care after the treatment, then there is an excellent hygiene and this is resolved to the left down. If there is excellent hygiene and unresolved pocket, then surgical therapy take place. If there is poor hygiene, non-surgical therapy will take place, then it goes to reevaluation of recall therapy and so on. The 5 phases of periodontal treatment: 1. Preliminary phase, phase 0 our emergency phase. 2. Phase 1 therapy, non-surgical phase. Phase 2 therapy, surgical phase, and phase 3 therapy, restorative phase. Phase 4 therapy, maintenance phase. Periodontal treatment follows a structured sequence of 5 phases. Each phase plays a crucial role in the patient's journey to better oral health. Let's go through them one by one. Preliminary phase of phase 0, emergency treatment. Treatment emergencies such as periodontal abscess, endodontic infections, and extract hopeless teeth if there is anything with severe bone loss, non-restorable, so extract it. Before beginning periodontal treatment, we must address any urgent issues like abscess or severe infections. We also identify and remove hopeless teeth, those with severe bone loss and no functional restoration potential. Phase 1 therapy non-surgical treatment includes plaque calculus control, scaling root planning, oral hygiene education, correction of faulty restorations, local systemic antibiotics if needed, and periodontal reevaluation for up to 8 weeks after treatment. Phase 1 focuses on controlling plaque and improving patient hygiene. Scaling and root planning are performed, and local factors like overhanging restoration are corrected or removed. After 4 up to 8 weeks, we reassess healing and improvement in periodontal health. This figure shows us how, as a dentist, we should know if there is a clinical attachment loss or not, depending on the root length. In this case, we know the root length is 13 millimeter, and to the left we have the probe, which we could measure the depth of the pocket. So at the cement enamel junction to where the probe stops, we count it. Let's say in this case is 5 millimeter. If there is any recession on the gum, then we count we taking the pocket depth and we adding with the recession height of the recession. So let's say if the recession is 2, we add to the 5, so clinical attachment loss for this case would be 7 millimeter, and so on. Phase 2 therapy surgical phase includes pocket reduction surgery, hard soft tissue grafting, periodontal regeneration, placement of dental implants, and endodontic therapy, of course, if needed. If phase 1 doesn't yield the desired improvement, we proceed to phase 2, surgical treatment. This involves procedure to eliminate deep pocket, regenerate lost tissue, and even place implants where necessary. Phase 3 therapy, restorative phase. Restoration such as crowns, bridges, partial dentures, implants, and occlusal adjustments for function and stability. Once periodontal health is under control, we move to phase 3, the restorative phase. At this phase, we focus on restoring function through crowns, bridges, or implants. Phase 4 therapy, maintenance phase. Regular periodontal checkups every 3 months initially. It depends on the case again. Monitoring pocket depth and inflammation, professional cleaning, and patient education. Periodontal maintenance is a lifelong process. Patient must return for regular checkups, and initially, maintenance visits are scheduled every 3 months, depending on case. Based on progress, some may transition to biannual visits, but anyone who has had periodontal disease remains at risk for recurrence. Risk factors in periodontal disease. 4 types of risk elements, such as risk factors causal, like smoking, diabetes, pathogenic bacteria. Risk determinants unchangeable, such as genetic, age, gender, socioeconomic factors. Risk indicators not causal, HIV, stress, osteoporosis, or bone resorption or breakdown. Risk markers, quantitative association with the history of periodontal diseases, clinical attachment loss, and so on. Understanding risk factors is essential in periodontal treatment planning. While some are modifiable, such as smoking or diabetes management, others like genetics are not unchangeable. Monitoring previous disease history is critical and important in predicting future risks. And here the picture shows us before and after of periodontal treatment, such as grafting of the tissue, connective tissue. If we look at the tooth number 3-1, to the left is the level of the gum is reduced, but looking to the right, after the treatment, after the grafting treatment, then the gum looks like is not decreased, so the treatment looks good. as we see in the picture to the right after the surgery. And for the summary, we know that this phase of periodontal treatment includes 5 phases or 5 steps: preliminary, emergency step, phase 1 non-surgical therapy, phase 2 surgical therapy, phase 3 restorative therapy, phase 4 is maintenance of oral hygiene. Goal of periodontal therapy: short term to reduce inflammation, improve comfort; for the long term, maintain function, prevent disease recurrence, to prevent disease to not come back or minimize at least. So yeah, that was all. In summary, I would also add periodontal treatment follow a structured plan, beginning with emergency care and progressing through non-surgical and surgical interventions, restoration and lifelong maintenance. Understanding risk factors help us predict and prevent disease recurrence, and so on. And thank you for listening, everybody out there. And this was all for me. If you're interested to read more about this topic, the treatment plan, and all those 5 phases or steps, you can check any reliable sources out there, or maybe check on this website which I used information from. Thank you, everybody, and bye.